Hello, my name is Raylan Ritchie and I'm a physician assistant with Complete Woman Care. Today I'm going to talk to you about the urodynamic testing. Your physician may have recommended this test to help look at the flow of your bladder. This urodynamic test is a simple, painless study consisting of a series of tests that allows for the evaluation of any problems you may have with storing or emptying your urine. There are many reasons that you may need a urodynamic study. Some of the most common reasons are you may be incontinent or have leaking of urine. Another reason is that you may not empty your bladder fully after going to the bathroom. You may also have uncomfortable symptoms such as the frequent need to urinate or the urgent need to urinate. Your urine stream may be weak, and finally you may have persistent urinary tract infections that we'd like to find out why. The urodynamic study focuses on the lower urinary tract. The lower urinary tract has two main functions. One is to store the urine, and the second is to empty the urine. There's also two main parts of the lower urinary tract. The first is the bladder. This is a muscle-lined organ which collects urine until you're ready to release it. The urethra is a canal which carries the urine from the bladder out of the body. To empty urine, the urethral sphincter and the pelvic floor muscles relax while the bladder contracts. What will happen during the urodynamic study? The study provides valuable information on the bladder function for your physician to help make recommendations for the treatment that is most optimal for you. This study does not require sedating medication. When you arrive at the clinic for your test, you will be asked to undress from the waist down, and a drape or gown will be provided. The study will take about 15 to 30 minutes. The urodynamic test consists of several different parts to evaluate the lower urinary tract. These tests include the uroflorimetry. This test measures the amount and rate of urine you void from the bladder. This non-invasive study is frequently used to screen for bladder emptying problems. During this test, you will be asked to urinate into a special container. This container is placed under a commode and is attached to equipment that allows us to examine how much urine is excreted. Another important test is the cystometry. This test evaluates how much your bladder can hold and how well the bladder muscles function and how the neurological signals work that tell your bladder that it is full. This is the primary test used to reproduce and evaluate symptoms of incontinence and other bladder problems. During the cystometry test, a catheter will be inserted through the urethra into the bladder. Through this catheter, your bladder will be filled with sterile water. A second catheter may be placed in your vagina to provide additional data. You will be asked to report any sensations you feel, and if they are similar to ones that you have at home, you may be asked to cough, bear down, or stand during the test. Another important test that we may perform is the urethral pressure profile study. This test evaluates the amount of pressure in your urethra. This information can be used in evaluating the different causes of incontinence. During this test, the bladder catheter is withdrawn slowly from the bladder, and special equipment generates a urethral pressure curve. A final test that is performed is the pressure flow study. This test is an in-depth measurement of the pressure and flow of urine out of your bladder. This study is valuable for evaluating problems with emptying urine. The pressure flow studies can be performed after the cystometry studies. You will be asked to urinate with the cystometry catheters still in place into the funnel attached to the special commode. We've mentioned many reasons that your doctor may have ordered a urodynamic study to look at the function of your bladder, but there are some other reasons that your doctor may not know about that we do need to know about. Certain medications like diuretics, anticholinergics, alcohol, narcotics, psychotropics, and caffeine may play a role in bladder function. It is very important that you tell your doctor if you are on these medications. For more information, visit the Complete Woman Care website or call one of our offices.